Hi doctors, my name is Dr. Lama and the topic today is pancreatitis. Pancreatitis is an inflammation of the pancreas. It has several causes and symptoms and requires immediate medical attention. It occurs when pancreatic enzymes that digest food are activated in the pancreas instead of the small intestine. Acute pancreatitis. It may be acute beginning suddenly and lasting a few days or chronic occurring over many years.
More often than women. Certain diseases, surgeries, and habits make you more likely to develop this condition. This condition is most often caused by alcoholism and alcohol abuse. Actually, 70% of the cases in the United States. Genetics may be a factor in some cases. Sometimes the cause is not known, however. Other conditions that have been linked to pancreatitis are autoimmune problems when the immune system attacks the body, blockage of the pancreatic duct or common bile duct, the tubes that drain enzymes from the pancreas, also damage to the ducts or pancreas during surgery, high blood levels of fat called triglycerides or hypertriglyceridemia.
Second, severe upper abdominal burning pain radiating to the back, nausea and vomiting that is worsening with eating. The physical examination will vary depending on severity and the presence of internal bleeding. Blood pressure may be elevated or by pain or decreased by dehydration or bleeding. Hair and respiratory rates are often elevated. As is common in abdominal disease, bowel sound may be reduced from reflex bowel paralysis. Fever or jaundice may be present. Chronic pancreatitis can lead to diabetes or pancreatic cancer. Unexplained weight loss may occur from a lack of pancreatic enzymes hindering digestion. Here are the symptoms of pancreatitis.
In the upper left side or middle of the abdomen, but sometimes it can be all over. The pain. It may be worse within minutes after eating or drinking at first, especially if foods have a high fat content. It becomes constant and more severe, lasting for several days. May be worse when laying flat on the back. May spread or radiate to the back below the left shoulder blade. People with acute pancreatitis often look ill and have fever, nausea, vomiting, even sweating. Other symptoms that occur with this disease include clay-colored stools, gaseous abdominal fullness or distension, hiccups, indigestion, mild yellowing of the skin and whites of the eyes called jaundice, skin rash or sore, and a swollen, distended abdomen.
In Ecuador, diagnosing pancreatitis requires two of the following. Characteristic abdominal pain, blood amylase or lipase will be 4 or 6 times higher than the normal variation. Abdominal ultrasound is generally performed first, which is advantageous for the diagnosis of the cause of the pancreas. Abdominal ultrasound also shows an inflamed pancreas correctly. Sign and text.
Form a physical exam which may show that you have abdominal tenderness or a lump or mass, fever, low blood pressure, rapid heart rate, and rapid respiratory rate. Laboratory tests will be done. Tests that show the release of pancreatic enzymes include increased blood amylase level, increased serum blood lipase level, and increased urine amylase level. Imaging tests that can show inflammation of the pancreas include an abdominal CT scan, an abdominal MRI, an abdominal ultrasound, and sometimes even plain X-ray can show calcifications of the pancreas as shown on the picture on the right. This is more.
Treatment. The treatment of pancreatitis is supportive and depends on severity. Morphine generally is suitable for pain control. There is a claim that morphine might compress the sphincter of Oddi, but this is controversial. There are no clinical studies to suggest that morphine can aggravate or cause pancreatitis or cholecystitis.
Fluids given through a vein or IV, and stopping food or fluid by mouth to limit the activity of the pancreas and let it rest. Occasionally, a tube will be inserted through the nose or mouth to remove the contents of the stomach, nasogastric suctioning. This may be done if vomiting or severe pain do not improve, or if a paralyzed bowel or paralytic ileus develops. The tube will stay in for 1 to 2 days, up to 1 to 2 weeks, depending on the severity. Treating the condition that caused the problem can prevent repeated attacks. In some cases, therapy is needed to drain the fluid that has collected around the pancreas, remove gallstones, remove blockages from the pancreatic ducts. In most severe cases, surgery is needed to remove dead or infected pancreatic tissue.